Going forward, we're going to get more and more results that are uncertain as we do more genomic testing, so more variants of uncertain clinical significance, the VUSs. And I think a real challenge for genetic counsellors is going to be helping patients adjust to that uncertainty and sort of fostering their resilience to that. Genetic counsellors need to be innately curious and interested in people. Following on from that, a really key skill for genetic counsellors is empathy. There is an element to which it's important to have the emotional aspects of empathy, but also the cognitive aspects, so really understanding where someone is coming from. And I think that's really important as people make difficult decisions. A particularly memorable case for me is that of a woman who was in her mid-30s who came for predictive testing for a pathogenic variant or gene alteration in BRCA1. The case stuck with me because it reminded me of the importance of really taking the time to understand where someone is coming from and what their story is to understand what the impact of a result might be. The gene alteration was found in her mother, who had breast cancer, also in her 30s, and the woman I saw was having genetic testing to find out if she had inherited this. She had a high level of anxiety about her breast cancer risk. She had been involved in the end-of-life care for her mum. This had left a deep impact on her. If she had inherited the gene alteration in BRCA1, while it would mean she had this increased risk, she could also access additional screening and also possibly risk-reducing surgery if she chose to. And for that gave her control, and that control she felt would be really important for her going forward in managing her anxiety. If she didn't inherit the alteration in BRCA1, she felt that she would still have all this anxiety about her breast cancer risk, but she wouldn't be able to do anything to control that anxiety. That case just brought home to me the importance of taking the time to understand where someone is coming from, what their story is, and how that will impact the emotional response to a genetic test.